I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hello, listeners. This is Dr. Fiona Lovely. Thank you for joining me for the Not Your Mother's Menopause podcast. And today I have someone I know personally joining us on the show. And I tell the story a little bit into the interview here about why I asked Belinda to come on the show. But I think it'll be obvious pretty quickly. So if you or someone you know is going through a breast cancer diagnosis and experiencing breast cancer at the moment, I hope this conversation will be helpful for you. Ultimately, I wanted to bring someone with a recent experience about breast cancer or with breast cancer to come on the show to talk about options, really. And Belinda's sharing her experience, and hopefully that will empower you as you're going through it, hopefully successfully and well, and it's just a blip on your radar. But she's going to give you some empowerment to make your own decisions here, because you can do that. And sometimes we don't always know that. And so sharing, I think, our stories, we drop the taboo, we drop the shame, and we can just get about the business of healing. So let me introduce my guest today. Belinda Pyle is a registered massage therapist and craniosacral practitioner. Her journey into massage therapy began with her mother's nurturing touch, which she experienced from infancy. Her mother, a nurse, was also trained in Swedish relaxation massage and used massage to connect with and calm her patients. That, of course, earned their adoration and improved their well-being. This early exposure to the benefits of therapeutic massage inspired Belinda to pursue formal training in massage therapy, despite initial challenges due to a concussion. Craniosacral therapy played a pivotal role in Belinda's recovery, allowing her to attend massage therapy college and later specialize in craniosacral therapy. Now based in Calgary, Alberta, Belinda is committed to continuous learning and passionately helps her patients heal, drawing on her extensive experience and deep empathy. And I'm here to say she's a special kind of practitioner. I happen to be one of her patients, and I'm grateful for it. And few have the kinds of instinct, intuition, which we talk about a lot in the show, and great hands as Belinda Pyle does. So without further ado, let me introduce you officially to the conversation I had recently with Belinda Pyle. Right then, listeners, it's spring, the days are getting longer, and if you're anything like me, you're feeling that little nudge to shake off the winter cobwebs. And just like we might be tackling the clutter at home and washing walls and doing what my grandmother would have called spring cleaning, it's a brilliant time to think about a bit of spring cleaning for our bodies too. Now, hands up, who of you has a whole shelf dedicated to various supplements? Me too. Well, these days, I've simplified things brilliantly with AG1. It's my little daily habit, and honestly, it helps me feel so much more energized as I embrace these brighter mornings. It's just one simple drink to support your digestion, your energy levels, and even our skin from the inside out. And because we're all busy bees, especially as we get out and about more in this lovely spring weather, the AG1 travel packs are an absolute godsend for staying consistent on those weekend getaways or busy work days. Now, when it comes to our health, we want something we can really trust, and that's why I choose AG1. With science-backed ingredients and real benefits I can feel, AG1 makes it easy to support overall wellness every day, and that's why I've been partnering with AG1 for so long. AG1 is offering new subscribers a free $76 gift when you sign up. You'll get a welcome kit, a bottle of D3K2, and 5 free travel packs in your first box. So make sure to check out drinkag1.com/Fiona Lovely to get this offer. That's drinkag1.com/Fiona Lovely to start your spring on a healthier note. I'm delighted to have AG1 as a sponsor of the podcast. Remember, it's a foundational nutrition supplement, and I drink my AG1 every day to support my immune health. It's all part of feeling our best during this fabulous next chapter. Oh, we're in for a treat today, ladies. I'm so excited to have my friend and my practitioner, Belinda Pyle, with me. Belinda, welcome to the Not Your Mother's Menopause podcast.
Hello, Fiona.
Okay, so just for everybody listening, Belinda and I know each other, and she is my craniosacral practitioner. And when we first met and I was on her table under her incredibly talented hands, she started to tell me the story of her breast cancer journey. And it touched me deeply. And in that moment, even though she was working and I was acting as her client, I asked her if she would consider coming on the show to share her journey. And I did mention to you, Belinda, do you remember this? I did mention to you, I was like, okay, listen, I'm not one of those podcasts that has like, your aunts listen and the neighbor down the street. Like, this is a legit situation. We've been menopause media at Not Your Mother's Menopause podcast for 10 years and have millions of downloads and listeners. And I wanted you to be sure that you felt comfortable sharing your story. Do you remember that?
I do. Yeah.
Yeah.
It's amazing.
Yeah. And I asked you to just take a few moments, but it didn't take very long for you to get back to me. And you're like, now I'm ready to share this story. People need to hear about it. So here we are. You're on the show with me today to talk about a recent health experience that you had. And I find and you've shared the story with me, both written and verbally, but ultimately, I think that when we as women open up and share the things we've experienced, especially the things that are considered taboo or that we have shame about for whatever crazy reason, then there's no more opportunity for taboo. So I want to throw it to you a little bit, Belinda, but get us started. Tell us what happened. What have you been through?
You want the whole story or the Coles notes?
Well, however you feel is, you've shared this story with other people, and I know you've seen their reaction, and I can guess which things people will react to. I know what I reacted to. And so, we're having a coffee, you and I. Remember the first time you told the story? Tell us what's happened.
Where I tend to start is I'm cautious as to who I tell that I have had breast cancer, mainly because of the word cancer. Cancer evokes a strong emotion in people. Maybe your dog had cancer and passed away. Maybe it was your grandma. Maybe it was your aunt, your mother, your sister, your father, your brother, your next door neighbor. We've all been touched by cancer, and we all are prone to a fear of getting cancer. And so cancer as a word elicits strong responses in people. So I'm very cautious as to who I tell that I've had cancer because of that. And also because of that, there's a judgment that occurs when you've had cancer, when you've been diagnosed with cancer. People have these preconceived notions about everything we've been taught. Like, if you exercise, you're going to prevent heart and stroke problems. You're going to prevent cancer. Oh, there's all this cancer prevention. That's wonderful and it's great. And, take your antioxidants, eat a healthy diet. All this that we've been taught, there's judgment. So as a holistic practitioner, my background is a registered massage therapist for over 25 years and a craniosacral practitioner. I live and work in a very holistic field where there's judgment passed on how much water you drink. Do you take supplements? Do you work out? Do you eat well? What are your lifestyle choices? Because we believe that those lifestyle choices affect our diseases and our health outcomes. And I'm pretty healthy. I drink my water. I drink my, have my green tea and my healthy coffee, and I eat a good, healthy diet. I love to walk my dogs. I've always stayed healthy and active and preach that. So the judgment of, oh, you're a holistic practitioner and you have cancer, there's one judgment. Another is just cancer, that you have cancer for whatever reasons. So I kind of like to start with that because that's something that I always think of. And I've had the honor of working with patients who have had cancer and have gone through cancer treatment. And I've heard their perspectives and they've impacted me for sure. So I tend to start there, is whether I'll even share my story about cancer because of how cancer may have affected their life. And as a holistic practitioner that works with a lot of different patients, different clients, as some practitioners call them, I don't. I'm more medical based. I've always referred to my peeps as patients, and I have patience for my patients. I try my best to. I'm just cautious. I'm just respectful and cautious for them, that it could elicit a response in them. And for me, who likes to be judged? I don't want to be judged. So I tend to be selective in who I tell my cancer story to. And while I was undergoing cancer treatment, I was very selective as to who knew. And I've been pretty protective of my kids. At the time, they were a little younger. They're currently 10 and 12. And they don't need to know that mommy had to deal with cancer because of what they're going to hear at school and what their friends, again, because of what they've heard about cancer. I've shielded them. My kids are pretty open and pretty aware about a lot of things, but that's one thing that I said, no, this is mom's process, and my kids will learn about mom's cancer later. They don't need to go through this with me. I need to go through this, and I don't need to also be mama bear and have to explain my process while I'm in it to them. So those are choices I made. I also chose not to inform my dad that I had cancer because he was quite elderly. He passed away last year at 87. He had really strong opinions about cancer. And I'm his youngest of three kids, and he always referred to me as, his angel, the daughter that always cared for him in any capacity. And so we're really close, and I didn't want to hurt him with the cancer diagnosis, and I just wanted to protect him. And I'm glad I did. It was the right choice for me and for my family. So I guess the story begins at my family orchard. I grew up on 5.5 acres of orchard in Summerland, British Columbia. My dad had really hedonistic ideas about life, and he wanted to have a farm that he could support his family and have an income. He was a carpenter, and my mom was a licensed practical nurse, and they came from Germany, and they developed this beautiful 5.5 acres of terrace property, and they had apples and cherries and peaches and plums, and they had terraces of vegetables to feed us and walnuts and hazelnuts. Like, it was a perfect little Eden, little farm that he built. And as my parents aged, they couldn't take care of it, and they didn't really have much of a succession plan other than, oh, Belinda and her husband will come and help take care of this, and so will my son Alex, he'll come and help, and my daughter Suzanne, she'll come when she can. There wasn't much of a succession plan, so my husband and I did step up, and we did a lot of the work in the later years. And we have a refrigeration unit where we store the apples, and my parents would store them in these wood crates my dad had built. And one evening I was working late, which was pretty typical. We would go out from Calgary to Summerland, and we would do an apple run. So we would, if we weren't harvesting the apples, they were already harvested in the refrigeration unit. I think was that trip in November. I would pack over and sort all these beautiful apples into pre-ordered cases that we had all these lovely people that have gotten to know us over the years that we sell fruit. And I went to grab a box off the top shelf in the refrigeration unit, and it was snagged. And these crates themselves weigh about 8 pounds, and then about a good 40 pounds of apples inside. So we're talking 40 to 50 pounds for sure in this crate. And it was right up beside the actual fans for the refrigeration unit. And I went to stand on top of a stack of boxes to go get it. Done this many times before. And I was hit with a flash. And the flash was, my hair was longer than it currently is. The flash was my hair getting pulled into the fans. And this is a turbine. It's not going to stop. There's no stopping this. And the flash was my hair getting pulled into the turbine and literally being disfigured, disfigured, like horrible blood. It was graphic. It was one of the most disturbing premonitions I've ever had in my life, and I've only had a few. So I listened, and I got down off the crate, and I powered it down. We seldom power the units down. Powered it down and went, oh, my hair, like, that's not going to happen. That was the warning. Got back up on the box and went to grab this box of apples that was snagged. Pulled harder, and the darn box came fully onto me. The corner of the box went into my right breast, and the whole box and the whole thing came down, and I let out probably a hell of a scream because the breast took the full brunt of this box with the load as me and the box came down. So the box hit me and I just screamed. And normally I would, clean up the apples and turn off, put my apples away and deal with it. I left everything. I turned the unit back on, turned the lights off, and went in the house and literally packed my bra with ice. And it was about, I think, about midnight. I was working pretty late. And my dad happened to be up. He was a night bird. And he, in his wonderful German accent, was like, "Oh, Belinda, what, you're working late. And what happened to you?" And I'm like, "Oh, Papa, I had an accident in the fruits in the cooler, and a box got me in the breast, actually." And he's like, "Oh, Scheiße, that's no good. That's sensitive. That's no good for you. You're working too late." And I'm like, "Yeah, I know." And he's like, "Well, good night and take care of that." By morning, my breast was black and blue and swollen. And within a week to 2 weeks, there was a palpable cyst where the box got me in the breast. And that, to some that have heard this piece, have said, "Oh, cancer can't come from trauma." And yet I've heard of physicians that on a regular basis, if they've had a female patient go through a motor vehicle accident, because of the seatbelt, they will send them for an ultrasound and mammogram within 3 to 6 months post MVA. I've just recently came across a physician I talked to about that, which was pretty interesting, because they said absolutely trauma to the breast tissue is specialized and sensitive tissue. We just want to be cautious, right?
Mm-hmm.
So that was the trauma that I believe, and that is where my cancer tumor did grow. Close to 2 years later, the cyst turned from a cyst, we thought it was a cyst, to a ductal carcinoma in situ. So that's a cancer that forms in the duct of the breast for the milk. And my family physician knew about that. It was during COVID. He said, he palpated it, checked on it. I said, "I'm pretty sure it's a cyst. It's movable. This is where the box got me." Told him of the trauma. He says, "Yeah, cysts form in response to trauma for sure. We're just going to keep an eye on it because of where it is." And he gave me a requisition for an ultrasound, and I phoned, and it was a couple of months wait, and I didn't book the appointment, which is not like me. I would always follow through. But it was COVID time, and we were 2021, I think, and it's just a cyst. It's okay. I'm gonna palpate it myself and keep an eye on it. Well, it changed. I kept doing breast self exams, usually in the shower, just because it was easiest in the most private. And I was doing a self exam in January 2023, and I palpated it, and it was bigger, and it wasn't moving, and it felt hard, and I felt a black cloak come over my whole body, and I knew I have cancer.
Yeah.
I knew it right then. I have cancer, and proceeded right away that morning to call my family physician to get in for an appointment. And he palpated it, and he's like, "I don't like this either. Let's get you in for an ultrasound and mammogram right away." And that right away took until March.
Pause the story right there for us, please, Belinda.
Sure.
First thing I want to say to the listeners, I have come to know Belinda, and she has the ability to sense things, that she has this extra perception, let's put it that way. So when she talked about the dark cloak coming over her, I mean, that's beautifully described. I think the truth is, Belinda, and I'm sure you will agree with me, that we all have the ability to sense these things. We just either were never taught to know what that was, or we ignore it. And women in
Yep.
particular have this sense. I get them too. So you and I are speaking the same language. I want to come back to the breast trauma causing cancer, because a little bit later in your story, which you're going to tell us, you actually had one of the breast oncologists or the oncologist say to you that those things are not connected. Is that correct?
Correct. Yeah. Completely dismissed.
Yeah. Okay, so we are familiar with the phenomenon, shall I say, of women being dismissed over their health issues or knowledge about our bodies. That's certainly how I started to become interested in women's health, because I had a doctor dismiss me about my body in my 20s. And this is a common story. Now, I tried to see if I could find any science on this, and it's pretty thin on the ground. Now, you and I both know in our line of work that that just means nobody's looked at it yet.
Yeah.
So, I would like to talk a little more about the breast trauma situation, because I know the way I've heard this talked about was that women who have emotional trauma of a certain kind, the kind that leaves a burden to bear, typically increases the woman's chance of having either breast cancer and or heart disease, the holding in of things on the chest. And I know I've heard that spoken of for decades at this point, certainly not by mainstream medicine. So I'd love to hear a little more of your thoughts on that.
Beautiful segue, Fiona, because that's
Ah!
where we're going next.
Okay, great.
That's absolutely where we're going next. That's the next big piece of my story is, when you're diagnosed with cancer, why? Why do I have cancer? And like you just said, I'm an intuitive individual. I have learned to trust my intuition and develop it further. And I believe the same that we all have that sixth sense and more. And it's a matter of trusting it, believing in it, and developing it. And having the support to do that, having the people in your life that don't poo poo or taboo it or, that's hooey or disbelief. So I've been blessed in that I attract the people that support me and that get me. And I continue to. And I'm grateful for all those people that have come into my life and that are in my life that support that. Yeah, I'm maybe a little bit more unique than others, but not that much. I just trust my intuition. And what's interesting, or maybe perhaps interesting isn't the right word, but what's curious about me and that I've been told by individuals I've shared my story is that I right away viewed cancer as a gift. I didn't view it as this is evil, this is demonic, this is, it's going to kill me. Fear cancer, fear it, fear it. This is my body. I grew it. I grew two babies in my womb. This is my breast tissue, and my cells changed. There was contributing factors to provide an environment for my cells to mutate and form cancer instead of healthy cells. I grew it. It's mine. It's in me. I loved it. It was a gift. It was a huge awakening that said, whoa, your life's out of balance. You are putting too much into being a mother. You are putting too much into being a loving and nurturing daughter to your elderly parents. You are putting too much into their family farm. You are not putting enough into your marriage on some aspects because you're spreading yourself so thin. This is a major, the scales were way out of balance. And cancer came because I was out of balance. I wasn't sleeping enough. Perimenopause had begun. And emotionally, yeah, I was bearing the load of my family on my shoulders the best I could. I worked that farm so hard. I recall one of my siblings saying, "You're a machine." Like they came out to help one weekend. They're like, "You're a machine. You just get up at 5, you do the irrigate, like you just tick, 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 and work." And I did. And I worked very physically hard. That orcharding and picking fruit and thinning fruit and pruning trees, it's all physical. We have no machines that do that. We're old school German people. We did it all by hand. Kept doing it that
Yes.
way. And I worked hard and was proud of it and proud of the fruit we produced. But I had spread myself too thin. My mom had a stroke, 2 strokes, and my dad was aging rapidly with osteoporosis. And I stepped up. I picked, I'd go out over 4 days and I'd pick several thousand pounds of apples by myself. My dad just simply drove the tractor with the bin and I picked all the apples. I packed those apples. So the fact that it was an apple crate that got me, I looked at that aspect as well. Found it very funny when my naturopath suggested a antioxidant pectin-based supplement right away that was from apples. And I said to my naturopath, the apple crate story, right? Like, seriously, more apples?
As near
Apples
as I
did
can
this
tell.
to me, and now apples are going to make me better?
Apples have a bit of a history, right? Snow
There's a
White,
history here.
Eve. So basically,
Exactly. Like we're going back a long time here
a
with
long
these
time.
apples. So watch these apples, ladies.
I love it. I love it. So basically, the cancer was a call to boundary up. Did I get that
Yeah.
correctly?
To make major life changes, to look at how far the scales were out of balance, and that I needed awakening. I needed a shake the apple tree and shake down the apples. I needed that.
Yeah.
And it's a
Wow.
gift, and I loved it. And so I put hands on my tumor every day, started every morning with prayer. And I was praying. And it wasn't praying for the tumor to not take me. I wasn't praying that, God's outcome is that I survive. I was loving it. I grew it. I had the trauma. My life's out of balance. I love me. I was putting love into me and love into my tumor. And you know what? It got a little softer. And I believe it got a little smaller. And I accepted, the treatment plan that was laid out for me. I accepted some components and some components I did not. And like I said, I believe that cancer came as a gift to me. It came as an awakening. It came as a learning. And I also believe that when I was in the midst of, okay, here we go. In May, I was diagnosed in March. I'm going to have surgery in May to remove the tumor. Um, in that time, I really felt spiritually awakened. I really had a lot of amazing insights, and I did my best to journal them. And I really did feel that I was protected, and that I was going to be good, and that part of why I have cancer, one of the many reasons that I believe God permitted me to have cancer, is to know what it's like to go through the cancer process, and so that's a whole area of my patients and in the future that I can understand from a lived, gone
Mm.
through experience that I've been through
Yeah.
cancer. Because unless you've walked a mile in a man's shoes or woman's shoes, thank you,
Yeah.
their shoes, whoever's, you don't know what it's like. And to be in the
Absolutely.
cancer world is an interesting experience, and it's definitely not something um, from a holistic paradigm that maybe is viewed as kind of woo woo or out there, or let's put crystals and special lights on. That's not my world, but it's also not the starkness and the coldness of some of the aspects of oncology that I discovered.
Ooh, my God. Let's pick that apart, please. So let me ask this question because I keep thinking about it. How old were you when you experienced cancer?
I'm 46 now. I was diagnosed in 2023, so I was 43.
Okay. All right. So chances are far younger than any of us that's listening is thinking about breast cancer, right? We're thinking about
Yes.
breast health. We're thinking that's something for our mothers and our grandmothers. So that's the first thing that's I think really important. But what I hear from your story, Belinda, that I think is most powerful is that you didn't enter the cancer experience with the victim mentality.
No, definitely
Now,
not. I was the opposite, more of a
so
warrior.
to the woman who is listening to you and saying, I want that, how do I get that? Can we talk about that, please? Let me just start talking. And when you feel like you've got something to add, please do. A few things come to mind. First of all, when we get a big, scary diagnosis, we think of the stuff we've seen on TV, people dying of cancer in horrible ways. The statistic, by the way, around breast cancer is that 90% of women who experience breast cancer will survive. Why isn't that shouted from the rooftops, right? Instead, we see very specific imaging around, pink ribbons and all of this business, all right? So, why are we not hearing about the 90%? Number one. So I think there's lots of opportunity for us to sort of dive in. And I've had other experts and guests come on the show to talk about breast cancer. And I think one of the things that sticks out most to me in those conversations was Dr. Jen Simmons saying, you have time, relax, find your people, find your team, get your supports in place. And the supports for you sounded very much like self love for your body
Mhm.
and prayer. Now, prayer can be called intention or whatever else you want to call it. It's not specifically a religious thing, it's just a spiritual moment with yourself, ultimately, is what you had. So, um, how do you feel about those things? Were those part of what you were up to?
One of the stats that I was told is 1 in 8 women will have breast cancer in their lifetime. Why are they telling us 1 in 8? Like that's pretty scary. And like
Yeah.
you just said, 90% will survive it.
Yep.
So I'm beyond grateful to all the women who came before me and have had breast cancer, that have given of themselves, their bodies, their souls, their process to the medical world, and to be researched, and to know, to be able to, and that the research that's occurred, that they've figured out all these different types of breast cancer, and some are genetic, some are not. All the research that's gone into breast cancer is incredible, and that 90% survival rate, I believe, is because of that. And
Yes.
I am grateful. I am not knocking the medical system in any way. I'm grateful for my amazing family physician. I am grateful for the oncologists that I received care, for the receptionist that did my booking and that said hello to me every time I came into the Tom Baker Cancer Center, which is our local Calgary Cancer Center. Uh, I'm grateful for all the people involved, that helped me, to assist me to be here, and and all the women that have come before me, and all the women that'll come after me.
You have a patient on the table, and they say to you, I want to love myself better. How do I do that? Maybe easier to take yourself out of it and say, how
Maybe
would you walk your client through that, your patient through that?
I would first acknowledge that what they've said. So you're wanting to love yourself and love yourself more. Where do you feel that? Where do you feel love in your body? And where you feel that love in your body, does it have a color? Does it have a shape? Does it have a smell? Does it have a sound? Does it have a feeling or a memory? And I go much slower than that, obviously, waiting for
Yes.
their responses in between and really
Yes.
bring them as deeply into their body as possible to find that love and to acknowledge it and really feel it. I think so often in body work and in life, we can engage pain and we can engage our wounds. Love and joy seem to be harder for people to get to. And to find your love for yourself, there's a big piece of acceptance. And so accepting yourself where you're at now and perhaps in the past, and where you'd like to see yourself. And those are three big areas of self-acceptance and self-love. Um, as a body worker and in craniosacral therapy in particular, part of our training is really encouraged. You get on that treatment table, you get treatment, you get your body work done, and you deal with your stuff because it's imperative that you be as healthy as possible and that you understand the process from an experiential and a known, like you know it. You know the process, you know the experience, so you can properly support people from a neutral therapeutic presence without judgment. And we're not psychotherapists.
Mm.
So we're there to just support the process, like a really good friend that doesn't give you advice. And that's really key. How many friends have you sit down and have a coffee or tea or a glass of wine and they're giving you advice on your problem? Really, what you're looking for is just to be heard.
Yeah. Yes.
And we don't need to be fixed because all the answers lie within. We just need to stitch and bitch. We just need to be heard. Right? And and so, to me, it's
Yes,
true.
we
Women
absolutely.
used to, right? We used to do like, cross stitch or
Mhm.
knitting, and they'd sit in groups and they would stitch and bitch because they
Yes.
needed to. They needed their community of women and they needed to talk about the stuff that's pissing them off, their kids, their husbands, their jobs, whatever it is, the next door neighbor that won't mow their lawn on time, who knows? And so, because I've part of my work to become a therapist and to continue to evolve as a therapist is to do your own work. And so, I have done a lot of, I have a great psychologist that I see, and she does some EMDR, which has been really powerful and helpful. I've always, I was fortunate in my teen years to seek out the high school counselor and realize that they're counselors and that they can actually help you. And I
Yes.
received counseling in high school, and it was really, really important and imperative. And I've always sought really good counselors to go and talk to because they are professionals trained to listen and they do give advice, but they give advice based on strategies and tools. Um, and so I've looked at my inner child. I've looked at my inner teenager. I've worked with her and I know her and I have loved her. One of the things I went and did early on in my 20s was art wasn't really encouraged. And so for me, and so I went and got a Winnie the Pooh coloring book and I started coloring Winnie the Pooh with pencil crayons. And it filled that void that I wanted to express myself without being judged in a form of art. And so I colored a coloring book and it was really enjoyable. Self-love. I love myself enough to go, this isn't childish to go get a coloring book and color. This wasn't an opportunity I had as a kid. And I do not need to place blame on my parents or on a sibling. It is what it was. And so I'm just going to honor that. I'm going to learn. I didn't get a chance to learn how to swim and skate properly. So in my 20s, learned to skate and learn to swim as an adult. Love it. Great. I can now swim. I don't have to place blame. I don't have to do shame. I can just honor who I am and see what I want a need and go and do that for myself. I don't need a partner to fill that void for me. I don't need to go to my parents when they were still living and blame them for not putting me in skating lessons. I don't need to do that. I just need to honor myself where I am, and that's self-love. And so when you can do
Yes.
that for yourself, you can help support others do that too. And so finding that self-love and self-acceptance. And I call it the blame shame game is that when someone places blame, it's a projection and it causes shame. And that shame causes pain. And when you're in pain, you go on the attack. And so then you're blaming. And so it's just this
Oof.
nasty, vicious cycle of blame, shame, pain. And
You've just
I don't believe in
described.
it.
Yeah, you've just described how many, many, many people exist and communicate and operate. And I'm not here to point that out to make anybody feel bad about it. But what I want to point out is that this kind of behavior was enabled by past generations. I
Mhm.
think humans were terribly bored, to be honest, and not always finding industry to keep our, or art for that matter. Like we've got these enormous brains. We must be doing something useful with this brain. In so many, for many cultures, for a long time, women were sort of marginalized and put into the category of, we don't get to do the really important stuff. So again, I think this is part of how we heal ancestral wise. You and I have talked about the ancestors quite often. We both have Euro parents, excluding my Saskatchewan farm dad. He's the what? He's the non-Euro parent in there. Um, but anyways, it's so what I hear in what you just said is that it's not necessary. I think a lot of us hang on to that trauma from our childhood because we're afraid if we start talking about it and processing it, we're going to end up blaming our parents, and we love our parents and we don't want to do that. So we hang on to the trauma and perpetuate more of that dis-ease within ourselves. And so what I take from what you just said, Belinda, is just that it's okay to just give yourself permission to bypass that whole thing. You don't have to shame or blame anybody. You can just be like, you know what, this is not me anymore. I'm letting it go.
Yes. Yeah. It's very Taoist. Let that shit go. Just let it go. Like why we don't have to analyze it. Dr. Upledger, who's the developer and founder of craniosacral therapy, he says there are times when analysis causes paralysis. And what a great statement.
Yeah.
We don't we don't need to psychoanalyze it to death.
Yeah.
Identify it, acknowledge it. What do I need from this? And move through it and then move on.
Yes. And move on.
I mean, if you can, I know there's big traumas, there's big hurts, there's big wounds, there's big abuse patterns, there's big stuff out there. I'm not trying to marginalize it or minimalize it. I'm just saying that for most of us, this is attainable. This is extremely attainable healing and being able to get to the process of surrender to ourselves and self acceptance and self love. And that a lot of our healing, I believe, stems from that.
Absolutely, it does. Absolutely does. And I love that you've given us all permission to do it easier than we thought it had to be done. We don't need to analyze it. We can just say, nah, we're good. I like to say on the show, that's old stuff, boo. Put it in the trash like a old pair of shoes, literally. And you know what's funny about this blend? I'm cleaning out my closet right now, and I literally found 3 pairs of jammies that I have had at least 10 years. I'm so embarrassed that sharing the story. Holes, the elastic's gone, so I've got it literally like tied up with like a piece of twine just about. Okay. And I'm hanging on to these things for dear life for whatever crazy reason. And I literally said to my husband, I was like, oh my God, like I feel like I just have to do this. I just have to move these into the garbage. And I didn't even take them and put them in the garbage in the bedroom. I took them down to the kitchen garbage and threw them in there. We hang on to this stuff. We hang on to our emotions too. And so I like to use the phrase like literally just drop them like an old used up pair of shoes into the garbage, or an old suitcase that somebody gave you that handed to you when you were a kid. You didn't even know what was in it. You didn't know it was yours. You don't have to carry it, boo. Just put it down. Just put it down. It doesn't have to. And then if you're feeling some stuff come up, go to the stitch and bitch and let it out. This is how this happens.
If you need that.
Belinda, you and I are organizing a stitch and bitch, right? Like we have to after you said that. Like
I
I
don't
already know.
cross stitch or knit.
Oh gosh, well, that's fine. You just bring something. Bring your Winnie the Pooh coloring book.
I will do the Winnie the Pooh coloring book. Yes.
See, I happen to love coloring myself. I loved it as a kid, and as an adult, I'm a huge fan. I've got the sweary coloring books, which won't surprise you at all, of course, but
No, it doesn't.
no, and all the fun like markers and pencil crayons, and sometimes I just love that whole experience. And actually I've had guests on the show talk about art as therapy. We had Susie Stonefield come on the show in December. I think that episode came out in January. I mean, just such an important thing, especially you and I have both been through the trauma and the grief of losing both of our parents in the last 5 years. And I
Mm.
do remember that was the first thing ultimately we bonded over. And
Mhm.
there is a special kind of grief that comes when both parents are gone. And this is what Susie Stonefield talked about on the show as we spoke about grief. And I love that we have these outlets now where we can start to play, and it's permissible for us at midlife to go, you know what? I'm turning off the computer and I'm going to sit. This is where I sit and knit, is right here when Hamlet's not sitting there. And
Mhm.
that's where I sit and do my knitting. Or we go and do our crochet, or we make bread, or we organize a cabinet, or, I mean, this is art. Organization is art
Mhm.
for me. I'm a little odd. Like, we have so many different manifestations of it. Now, I want to come back to your story, and I'd like you to share about what happened when you got to the treatment part of your cancer journey, please. Because I think there's some lessons to extrapolate there as well for the listeners.
So I got the call from my family physician. So my ultrasound and mammogram was on a Monday, and the radiologist came in after both procedures because they said, please wait, we'd like the radiologist is in. They would like to review your scan. And as she was doing my scan, she was doing my ultrasound. She's like, yeah, this is bigger than, like she was trying not to hint, and I knew it. I said, look, I know this is most likely cancer. I'm pretty certain this is cancer. And so they brought the radiologist in and they said, this isn't a cyst. This is a tumor. We would like to do a biopsy today. Can you wait half an hour and we'll do the biopsy and then we'll send the biopsy off. And because of your age, that you're younger, and the size of the tumor, it was already a small little baseball. Um, we want to get this. We want to take care of this for you right away. And so I said, yeah, I'll stay, of course. Let's do this. And so then they did an ultrasound guided biopsy, took it from a couple of different angles, and it was sent off. And by Friday, my physician called and said, they've sent it off. I know what the radiologist has already said. I've received the results. I have an amazing family physician. Talks to me very much like a medical colleague, which is wonderful given my field and that it's not as well recognized, both massage therapy and craniosacral. Have a lot of respect for him. And I called and said, we're going to get the results and hopefully we get them before the weekend. So you don't have to go through the weekend, worrying. And I said, you know, um, Dr. Leung, I'm not worried about the weekend. I know I have cancer. I know what the diagnosis is and I'm not worried. He says, well, hopefully it comes in by Friday. And by Friday afternoon, he gave me a call. And yes, I have breast cancer. And he said, it's an amazing team here in Calgary. You're going to be contacted right away, and they're going to take really good care of you. And I'm going to be with you every step of the way. You just have any questions, any concerns, you just call into the office, you book an appointment. I'm here for you. Okay. And then pretty quickly, all the referrals went out because of the type of cancer, and that I went first to surgical oncology, and it's a consult, and with the nurse and the surgeon, the oncology surgeon, and my husband came with, and he just went over the scans, went over my age, went over everything, and said, let's get this out as soon as we can, and it's going to be a major lumpectomy. Um, and it's not a minor lumpectomy. I'm probably going to take 40% of your right breast, about that. These are your options. You can reconstruct the breast at the time. You can do a breast rebalancing within about a year after surgery. So that's where they reduce the size of the other breast to make them at par. You can leave it be. These are the different treatment options. And um, I said, number one, life before breast. So you get in there and you have to take more tissue. You have to do a mastectomy. That's what you do. My kids need me, my husband need me, and I need me. That's my plan. And he was great with that. And then they booked the surgery, and I had the surgery. And at the time, I said reconfigure the breast because we'll do a balancing. We'll balance the other one because there's quite a breast size difference once the surgery was going to happen. And so he did that. And so he reconfigured the breast, and they took 5 lymph nodes with the chain of lymph channel between those nodes. And they found 2 lymph nodes had cancer in them. And so that meant the recommendation for radiation was then generated to go to radiation oncology. In the meantime, I was sent to medical oncology to look at my options. The type of breast cancer I had does not respond, and chemotherapy is unnecessary. So that was good news. Didn't have to do chemo. Radiation was recommended. And so I went to medical oncology, and that was my least favorite appointment and experience. And
Oh, you're
yeah,
being
then
kind.
later on, I can't skip over that part, can I? I kind of want to.
No, you can, but you're not naming names. Belinda, what I say on the show all the time is there's not bad doctors. There's just bad systems that people get trained in. Now, the truth is, there probably are bad doctors, but generally speaking, those guys get washed out of the system pretty fast. I believe that medical practitioners enter into their practice with the best of intentions. They're just sometimes the system is shitty. It's patriarchal, it's paternalistic, and it tends to ignore women and women's needs. So please share your story. You're not saying anything the listeners haven't heard before. Hey there, Not Your Mother's Menopause listeners. Let's talk about something we rarely think about, but totally should: nutrient absorption. You might be eating all the right foods, popping the right supplements, and still, your body might not be getting what it needs. Super frustrating, right? You see, the nutrients that fuel your energy, mood, memory, and even your sleep are some of the hardest to absorb. And let's face it, midlife doesn't exactly make it easier. Throw in stress, gut issues, meds, processed foods, and you're left wondering why you're still feeling blah. All is not lost. Have you ever heard of liposome encapsulation? It's like a nutrient delivery service with VIP access. Liposomes are tiny protective bubbles that safely shuttle nutrients straight to your cells, bypassing all of those absorption roadblocks. And when it comes to midlife must-haves, Live On Labs has you covered with their lipospheric supplements. Think ultra-absorbable vitamin C, B Complex Plus, and their star player, lipospheric magnesium. That last one, it's basically brain fuel. Magnesium L-threonate is the only form proven to raise brain magnesium levels, helping with memory, focus, and relaxation. It means it crosses the blood-brain barrier. That's pretty cool. Plus, they added choline to support neurotransmitter production. Oh, and MTHFR, you say? You know who you are. The B Complex Plus has methylated folate, so you get exactly what your body needs. And here's the best part. Live On Labs is offering Not Your Mother's Menopause listeners an exclusive deal. Head over to liveonlabs.com/lovely. That's livonlabs.com/lovely and snag the midlife bundle. You'll get vitamin C, B Complex Plus, and magnesium for $56 off. Your cells deserve VIP treatment. Give them the nutrients they actually absorb and get ready to feel like yourself again.
So the lengthy appointment, I was forewarned to be 3 hours. So bring a water bottle and a snack. Saw the nurse first and did a review of my case. Shared with her my Coles Notes version of the box story, and she was like, "Oh, that's interesting," and kind of gave me the hint, like probably wouldn't share that with the oncologist. Like kind of a hint, like okay. Then talked with the medical oncologist, and they're stats based. It's all research. It's stats. We're all stats. And so, hey, your surgery was successful. You are 70% recurrence risk has been removed from doing the surgery by removing the tumor. We believe you have 30% risk of reoccurrence left. 20% of that could be reduced by radiation. That was explained as a localized treatment to the tissue and to kill any cancer cells that could have been in those any other lymph nodes. So of those 2 of 5 that they've already removed, they removed those 2 of 5. Um, and then they broke it down into the remaining 10%, and they broke that into um, treatment in terms of, hey, you know what, we can shut your whole system down with hysterectomy, basically a medically induced menopause, to basically stop all these hormones, because the bottom line, or not, maybe not the bottom line, uh, it's implied that breast cancers are we're estrogen dominant. Women that are breast cancer, certain types of breast cancer, are estrogen dominant. And so if we, take away your ovaries and we shut you down, there goes your estrogen. So my reproductive organs are good. 2 happy, beautiful babies in that womb that are living with me and driving me crazy some days. And I breastfed both my kids from birth until they self-weaned around 2 and 3 years old. So I breastfed about 5 years. Um, so hey, my reproductive organs are functioning pretty nicely. I think I'll leave them in. Thank you. Another surgery, another risk of infection, because I had quite a serious infection with my breast surgery. So, okay, it's not an option I would be interested in. Thank you kindly for the offer. And then the next was like basically chemically inducing menopause to start right away. And I've been in perimenopause, as far as I believe, since I've been about 38. And so the recommendation there is estrogen reducing medications like tamoxifen. And so then you sit down and chat with their pharmacist, who explains the different drugs and that you can try them, and that we want you on tamoxifen for 5 years to reduce your reoccurrence by 6 to 8%. And when I started to read through the papers, and I had already done some reading on all of this, preparing for these appointments, the side effects are not nice. They're like menopause on steroids. They're much worse for most women. I read a lot of blogs of women who truly suffer through tamoxifen and I'm going 6%, and 6% reduction of reoccurrence. And I kind of thought to myself, I think I've done pretty good on praying. I think I'll stick with that. Didn't say that out loud. Don't say that out loud in front of them. Don't say that out loud. And so I walked out with not just a prescription I expected to leave with a prescription. No, I walked out with a bottle of tamoxifen to start, and went, and I asked the pharmacist, I said, I've been taking supplements to help manage my perimenopause symptoms from a naturopath. Can I continue on those? No, there's no research on that. It's anecdotal, and there's no research on that. So you take the tamoxifen and you stop taking your naturopath supplements, is the recommendation. Oh, okay. And it was all at the end of a 3-hour appointment, where, yeah, I did not feel particularly heard, but I'm just another patient. And, the referral was made to integrative oncology. The oncologist said to his nurse, I think Belinda's better suited with integrative oncology. And that was a very nice, you're not going to take the advice I'm giving you. I'm the medical oncologist. Like, I'm the doctor here. Like, and I'm going, yeah, and I'm the patient here. And I don't want to suffer through tamoxifen for the next 5 years and then potentially the after effects once I'm off tamoxifen. And I'm not going to have you give me a hysterectomy, which its history is in removing hysteria from a woman's body. You're not going to cut into me again. I'm a body worker. It does a lot of fascial damage, a lot of muscular damage. There's a whole recovery process. My reproductive organs are in good shape. I think I'd like to keep them. Thank you. And for that 10%. So my risk of reoccurrence. And I get it. It's all stats. That's their world. And I respect them for it. I respect their research. What I didn't respect is that not once did someone ask or imply that perhaps we should be testing hormones. Like, let's do some blood and urine analysis throughout maybe a cycle and determine, is our patient estrogen dominant, to be put onto an estrogen reducing medication for 5 years. So in terms of what I learned as a scientist and as a biologist, you got to control variables, and you start with the control factor of, okay, if my estrogen, or of 9 estrogens, estradiol, I think, is number 3, don't quote me. If it's in the 500, 600 range, that's probably high. If that's where I'm starting from, isn't the control, don't we want to see, while I'm on tamoxifen or an estrogen reducing medication, there's a group of them, that, hey, if you started off in the 600s, now on tamoxifen, you're in the 300s. Hey, the drug is working. There's no starting point of testing a woman's estrogen. There's
Yeah.
no during estrogen reducing medication testing, and no after. The only factor they're looking at is the reoccurrence of breast cancer. I didn't look at the research. I had a lot of other stuff going on. I was working on my own healing, not my focus. But my point is that where's the research? How old is the research? And why aren't we testing women's hormones? If you're telling me that this is like now another epidemic, but breast cancer, that so many women are going to have breast cancer, and so many women are now entering perimenopause earlier, why are we not looking at prevention? Why are we not looking at their hormones genuinely? So you're going to put me on a medication that you've not tested my estrogen. You tested my tumor, not me, for estrogen and
Yeah.
progesterone.
Yeah.
Okay. And you're not going to test me before, during, or after, just whether or not I get cancer again.
Yes.
Sorry,
Yes.
not very good
Well,
science. I'm
and
out.
this is the problem when we only look at the science and we don't consider things like anecdotal evidence. We don't listen to women's stories. We don't do comprehensive testing of the rest of the body. How is the actual, it's like in wine. We talk about the terroir in wine. It makes such a huge difference as to the product that comes out. Why aren't we looking at the entire human body? The human terroir. Why are we not looking at that? So estradiol's number 2, by the way.
Negative,
That's one of
sorry.
those random bits of information, Belinda, that's in my brain. I agree with you fully, and I sit here as not an oncologist and wondering why we are broad scale recommending radical hysterectomy, which is both oophorectomy and removal of the uterus as well, for treatment of breast cancer? Huh? Like, that's like saying to a man who has prostate cancer, okay, let me see. Like, how can I come up with an analogy? Okay. So I don't know. Let's
Wouldn't
remove.
castrate him.
Yes, well,
We
exactly.
wouldn't
Or
castrate him,
no, of course, it wouldn't even be suggested. Why
but
is
you'd
it
castrate a woman.
yes, all the time. In fact, it's the number
Mm-hmm.
2 most performed surgery in the United States. So it is a
Mm-hmm.
multi-billion-dollar business, which is probably only, I'm going to guess, the drug that you mentioned that you were offered, which has its own history and reputation. The research will be well funded for that. And we're going to throw a woman in, and this is the thing, you knew enough to advocate for yourself and say, so you're telling me I'm going to lose the quality of my life probably for the next 40 years, maybe more, for a 10% reduction? Thanks, I'll take the odds on that. But here's the thing, and I think what I'm hearing, and I can always hear my community behind me when my guest is speaking, and here's the sense I'm getting is that, Dr. Lovely, I don't feel like I know enough to ask the questions, and I don't want to make a fuss with the doctor. That's the term that I've heard women say to me. And I don't want to be the guy that's asking all the questions and appear rude. And I'm like, it's your body, babe. You have to be the advocate for it. And Belinda, you did
Yeah.
that for yourself so well.
Yeah, I mean, I left that appointment with a bottle of tamoxifen, and then I started digging, doing my
Yes.
research, and that bottle is unopened. I'd like to return it to the cancer center if they'd like to have it back. I don't know. It's probably it's 2 years. It's expired. I can throw it out now. I'm going to go do that. Let that shit go. Go throw it out.
Yes, yes.
Um, and I followed up and I let them know I've changed. I'm sorry. I'm not going to go through with the treatment with tamoxifen. And I spoke briefly on the phone with the nurse, and I said, "This is not the right choice for me. The reduction risk for 6%, approximately 6 to 8%, I don't feel is right for me with the side effects, and I'm going to decline the treatment. Thank you very much." Okay, I'll inform the doctor of that. And then I was released from the medical oncologist's care. And then I went through radiation and did 20 treatments of radiation. And it's a process and story of itself. And then had my follow up with surgical oncology, and I decided, no, I don't want another surgery. I don't want my left breast cut into. It's healthy. Let's leave it be. Um, and that's typically where I make the joke, and I probably shouldn't because it's on air, but because my right breast was reconfigured, I have one headlight and one fog light. So that's the joke I made to my husband. I'm like, are you good with one fog light, one headlight? Because I'm like our Subaru Outback, and that's the way my nipples point. And he's like, I'm all good with that. I'm grateful you're alive, and that you're still the person you've always been, and
That
just
is
better because of it.
awesome.
So maybe cut that out, but it's rather private. But anyway, it's the truth, right? It's the truth. And it's what I
Yeah.
live, and that was the decision. And so I let I had the follow up, and I said, he said, did the breast? It was in person. He said, because radiation, sometimes the breast shrinks or it swells. And I said, well, I've got lymphedema now in the arm, so I'm managing that, and the breast is about the same size as it was going into radiation, and I just don't want to. I don't want to be rebalanced. He said, yeah, I just have to inform you that, here in Alberta, you have this time period. And if you decline the surgery and you decide in a couple of years it's not going to be covered, that you would have to pay for a breast rebalancing surgery on your own. I said, I completely acknowledge and understand that. And I can sign off on that I know that, and that I'm declining surgery. And thank you for all that you've done for me. And
Yes.
then I was sent back to my family physician, and my family physician was like, "Hey, how come you're not under the care of the medical oncologist?" And I said, "For the next 5 years." And I said, "Because I turned down tamoxifen, and I'm returned to you." And so then we talked about it. And
Yes.
his concern was, he said, "I've seen a few women, Belinda, that have made very, not even have surgery, not to have radiation. They've made choices that are um, very holistic." And he says, I have two patients I can tell you specifically about, and they're not here anymore with me. They're not patients; they've passed. And I don't want you to be one of those women. I don't. I know your family. I know you have a son with autism that really needs you, and you advocate for him. I think I just want to inform you of all your choices and make sure that you're making really good ones. And I'm still, your family physician, so I'm gonna, we'll continue to monitor this. So we'll send you for breast ultrasounds every year. And, I've had a discussion with him about, I'm not so keen to have a mammogram every year. Um, could we just go with an ultrasound? And so we're debating that. We're working that out as a patient doctor situation. We're working that out. So far, we're happy with it. I'm at year 2 now. So this is my second breast ultrasound. Last year I did have the mammogram because it was the first mammogram after all of the cancer treatment.
Okay. Well, and to go back to the reconstruction surgery, I mean, what's the harm in waiting 5 years for your body to heal? As you said, life before breast, you get all the stuff sorted out, you're cooking, everything's good. Now you look at the fog light headlight situation and go, you know, I kind of would like to see a little more volume here. How about we just do well, there's no harm in that, is what I'm saying. But so often, and I think where a lot of us can end up is the fear of cancer hooks into a self-loathing that we were taught really young, and then the fear goes, oh my god, get it out, get out, get out, get out fast, I'll take all the things, like get it out, just give me all the stuff,
Yeah.
without really thinking about it, without really having respect and love for the vessel, because we certainly weren't taught that. We don't know how, as generally as a society, how to love ourselves. And I think then from that place of fear, you hear the C word, and then you hear nothing after that is said, nothing after the cancer word is used, where you have so many choices, you have so many options to do what feels right for you. And probably just to finally bring in something that you started with, that we started with together, was use your instincts about what's right. And if it goes against what your doctor says, babe, that's okay. It's totally okay. Listen to yourself and honor yourself first. That's really, really important. Um, so, by the way, was the experience with the integrative oncologist any better?
No, that was a pretty major disappointing. In my brain, integrative means mainstream medical and holistic. So
Yes.
I expected an oncologist that had a naturopathic background. She looked my supplements up on a second screen. It was a Zoom meeting.
Oh,
So when I told her I was on DIM,
yeah.
she had to look that up.
Oh,
She
come on.
also
That's
No,
basic
there's two
stuff.
screens in front of her. I could see it just like this with a Zoom. I could see she had another computer. She had another laptop, and it was a Zoom meeting. So she got a headshot. She did not get a full body. This is what I
Yep.
look like.
Yep.
She doesn't know.
Yep.
No.
Yep.
Do you think I'm chubby, Fiona?
Oh
Am I chubby?
no, of course not. You look gorgeous, by the
Would you
way.
like the sideways?
This top,
So she got a headshot,
this top
and
is
she got a
beautiful on you.
headshot,
Yep.
and she had numbers in front of her, which included my height and weight and age,
Yep.
and yeah, chubby. Risk factor for reoccurrence in cancer is chubby.
That was her way of doing integrative medicine. Oh dear.
Well, we talked about all the areas that I'd already taken care of. So really, we talked about psychology. We
Okay.
talked about,
Important.
cancer counseling, what's available, what's for free, and so forth. And I said, got that covered. I'm working on that. I've been with a psychologist since my mom died for grief. So covered that, covered the nutrition, covered diet, um, and the naturopathic supplements, and other conditions that I live with. I have a contact dermatitis. And so basically, all she had left was, if you got down to your ideal BMI, your reoccurrence risk is reduced significantly. So I'd recommend a diet. I'll send you an email. Try and start losing a pound a week while you go
Great.
through cancer treatment. And I was headed to radiation.
And okay. I mean, I'm
So I'm
laughing
sure it's
because
recorded.
yeah, it's so absurd. That's so absurd.
I'm
And
overweight.
the diet she sent you was probably eat more whole grains, right?
Uh, I don't remember if I even received that email or if I just put it in the trash bin. I don't remember. I was very disappointed, very
I
very
would say.
disappointed, and she pulled the tamoxifen bottom line yet again. So it
Is
was
that
like,
right?
well, your best recurrence risk reduction is by taking tamoxifen. So she continued to toe the line, and so
Okay.
I'm like, well, that was a waste of an hour and a half. Like
Yes.
that
Yes.
did nothing for me, but and I'm not going to be body shamed, thank you. And
No.
like I said, she had a headshot of me on Zoom, so I don't think that's fair either,
No.
um, at all. And to look at somebody's BMI, pretty outdated,
Yeah.
pretty
You think?
outdated.
Yes. Yes.
So it was pretty disappointing, and I was like, okay, that's what you got for me. Thank you for your
Yes.
time.
Thanks for the time.
Goodbye.
Piss off.
Right? Thanks for the time.
Oh, the ability to advocate for yourself, once again, ladies that are listening, is probably the most important thing that you can develop and do for yourself. It doesn't mean you have to read a bunch of scientific research. But listen, in the world where you're listening to this podcast now, we are now, when I started the podcast, there were no other menopause podcasters. Now there's a pile of us. Okay. So just start listening. Just start being interested in your body. Just start listening to the messages of your body because we shut that down. And what I take away from your story, Belinda, over and over and over again was not just your bravery in standing in the truth of who you are, but also saying, that doesn't work for me, or that works for me. I want more of that, or can I have that, please? And to go against what the recommendation was, I think is really powerful. That won't be what's right for every woman, but it
Mm-hmm.
wasn't right for you and you knew it. And
Mm-hmm.
years from now, when the research shows that trauma to the specialized breast tissue is a predeterminant of some type of breast cancer, you'll be like, I know, I tried to tell y'all, I know. You'll be here for it. Just like the doctor that gaslit me in my 20s and said the changes to my cervix were absolutely not at all connected to the birth control pill I was taking. And we know now. Yep, she told me
Oh, we know
that.
now. Yeah.
I know, I know. And so it's just take care of yourself. Self care, being able to say no is an act of self care. No,
Mm-hmm.
thank you is an act of self care. And you don't have to agree to everything that you're being offered in a scary diagnosis.
Mm-hmm.
Ask questions, be your own advocate. Now, I know that there will be people listening to our conversation today, Belinda, that will want to know more about you. Where can they find out more about you, please?
I'm a registered massage therapist in city of Calgary, Alberta. I have a private practice from my home. It's called Soul Experience. I don't typically market myself because I am home based, so it's usually by referrals from other practitioners and from people that have seen me in the past. But I am putting it out there, and I work part time at a multidisciplinary clinic in Mackenzie Town, which is close to my home, with two chiropractors, a doctor of acupuncture, and four other massage therapists. I'm the only craniosacral practitioner there. So you can find me at those two locations. I'm actively teaching assistant, so I go and help with the craniosacral upledger courses locally in Alberta. Yeah, and
Fantastic.
I wanted to share, Fiona, too, just quickly before we wrap
Please.
up, that in relation to the estrogen, the hormones, the tamoxifen, all of that. I'm not just I didn't just say no to tamoxifen and go on my merry way. I did some reverse engineering and went to a pharmacy that does compounding and asked who are the physicians writing the scripts for bioidentical hormones, because I had been on a wait list for two clinics in Calgary to see a doctor where they do all the testing and they take a look at your hormones and they determine if bioidentical hormones are beneficial for you and they prescribe them. I've been on two wait lists from before my cancer diagnosis and hadn't made a move on the wait list. And so now with the tamoxifen and all of the cancer process, it did become urgent to me. And so I ended up finding a physician that was doing research through University of Calgary on perimenopause. And I could see him as a walk-in patient and keep my family doctor, which was perfect because I love my family doctor. He's great. And I went and saw this doctor and told him where I was at and what I'm looking for. And do you think bioidenticals would be something for me? And what's the process? And he said, you're well into your perimenopause process and your cancer treatment. And so I would like you to get a home urine hormone analyzer system that is available and with an app and start daily testing. And so I test my follicle stimulating hormone, my luteinizing hormone, one of the 9 estrogens, which I think is number 2, like you said, Fiona, and my progesterone. And so I got on that right away. And within, and he said, come back after you've had 3 full cycles of doing that, come back in, then let me take a look at what's going on. And I'm really, I want to see what it looks like, and then we'll go from there. And he was integrative. He took a look at my supplements from my naturopath and said, these are great. Yeah, you're doing good. Done good, girl. Let's see. And so I continue to use that home urine testing device and did all the way through. So since June of 2023, and it's really telling me a lot about my perimenopause, when I ovulate, when I don't ovulate, when I can determine already, am I going to have a short cycle, a long cycle? And what was really interesting as well is that he shared with me, to his knowledge, I was only one of 5 women in the world that's using that analyzer going through breast cancer treatment at that time in 2023. And the 20 treatments of radiation, that chart, when you look at the hormones, is the craziest chart you will ever see. There
What
is
stress do you
no,
figure?
that's what the oncologist told me. Oh, yes, it's stress. And I'm like, you're radiating tissue that releases hormones, aren't you?
Wow.
So it's the craziest month. And then it took me like 6 months before the hormones had any kind of true normalcy to cycle after radiation. Yes, I'm in perimenopause. Fair enough. Take that in consideration, 1,000%. But then now I'm a year and a half past that 6 months post radiation. And you can see, yeah, I'm doing perimenopause, but there's a pattern to my perimenopause: short cycle, long cycle,
Yeah.
no ovulation, delayed cycle, like, skipping a period. I haven't skipped one yet, but soon to be, I hope. So
Seriously.
I am empowered in the sense that I am monitoring my hormones. I didn't just say no to tamoxifen, no to medical treatment about my hormones. I said, how can I empower myself to have control of these hormones? Because if truly the hormones are a risk factor for reoccurrence, I'm on this. This is my health. I have owned this. I have taken this out of the hands of the
Yeah.
medical oncologist. I'm now responsible for me. And so that's what I went and did. And it's been great. And I have recommended that home urine analysis system that can
What's
be
it called
bought
again?
online. Oh, I didn't mention it. I'm not sure if I'm supposed to.
Oh, you can. Oh, yes, you can.
Mira, Mira. And it was developed by a group of physicians, obviously including, I believe it's an OBGYN, for fertility, taking the
Okay.
guessing game out of fertility for women trying to conceive. And
Yeah.
had I had this system, had it existed when we were trying to conceive, my husband and I, a number of years ago, it took us 5 years to get our little fellow, I would have known, oh my gosh, I consistently ovulate early.
Right.
That's why I'm not getting pregnant.
Yeah, most women do. We actually ovulate between days 9 and 11, but that's not what we're told. If we get some sort of medical professional telling us when we ovulate, they say day 14. Well, listen, by the time if you're thinking you're having sex on day 14, that egg's long gone by the time you're doing that. And I
Yeah.
think that is one of the most powerful things, having done lots of fertility counseling myself with patients. Okay, let's come back to something you just said. Thank you for telling us about that. I love that you said you're owning it. You're not just saying no in that very Gen X way. No, I'll do it myself. You actually did it yourself. You didn't just turn down the authority. Um, but did you just say that your hormones were all over the place during radiation treatment?
All over the map.
Why are we not looking at that? Please tell me someone's looking at that.
I don't
That
know, Fiona.
that
Hopefully we can get it out there.
that means something. What does
I
it
think
mean?
so. It's not just stress. It's not just because you know what? Other than the first day that I laid on that radiation table,
Yep, of
where yes, tears came down my face,
course it
absolutely. And
did.
the tech said to me, you know, like you got to get it, like we got to do this, we got to get this under control. And she's like, I know it's scary, the first treatment and everything, and you know, she knew what she needed to tell me, and I said, thank you. That's not why I'm crying. I had asked the radiation oncologist and his team to not go above my clavicle, and they are. They're
Oh
also
dear.
radiating me from the back, through my back muscles, my fascia, my lungs, and I'm heartbroken. I asked for them to do a very localized radiation treatment. That's why I'm crying. I'm not scared of this. I'm doing this.
Yeah.
I have this. I can do this. I'm sad that they didn't listen to me because all of the lymph in the neck and around the
Yes.
clavicle, they're radiating.
So
That's why I cried on the radiation table.
did you get an answer why they chose not to?
I had asked for it during the consult, and they said, our team will determine the best for you. And that's what they determined. So, oh, I got that's my doorbell.
Oh my God, we need part
That's
two
my
of this
doorbell.
conversation. Wow. Okay, Belinda, I have a final question I ask all of my guests, and it goes like this. Knowing what you know now, what would you tell your younger self?
Honor yourself and love yourself no matter what.
That's
Pretty
beautiful.
simple.
It really is. It really is. Thank you so much for dispensing your wisdom, sharing your experience with my community. I honor you and I'm so grateful that you came on the show. Belinda Pyle, craniosacral magician. Thank you for joining me.
Thank you so much, Fiona. It was a pleasure, and I hope that the women can benefit, and that you know, and I hope that the medical community can I'm just asking them to listen. That's all I'm asking. I'm not criticizing. I'm just saying, please listen to our patients just a little bit more and have patience for our patients.
It's a thing. It's a really big thing. It's a tiny thing, but it's a really big one. Thank you.
Thanks, Fiona.
The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.